I first heard about COVID in February 2020. One day you've got a bustling downtown, and the next day it's like a wasteland. I mean, there's nobody downtown. It was shocking. I mean, imagine if you're a homeless individual downtown and there's nobody there. They had to think that the world was ending.
The people on the street were starting to hear a little bit about what was happening, and they were really frightened. You can imagine at the very beginning of this, if you didn't have a home and you didn't have a TV and you didn't have access to a radio or a smartphone, you're hearing a lot of rumors. And one man said to me, upset and very frightened, "I hear that Sulzbacher is shutting down. What will we do if you shut down?" It kind of chokes me up, and I said, "We will never shut down. We have never shut down. We will never shut down." No doubt about it, this has been the most challenging 18 months in the history of our agency.
Had to make immediate decisions of what would be the best for the clients that we serve.
You know, we are a crisis organization. We're dealing with crises every day. That's what we do.
You know, nobody had warning, nobody had data, nobody had guidance, and so we were just trying to make the best decisions we could with extremely limited information.
We have a really good collaborative nonprofit sector here, but particularly the homeless providers have always been a very tight-knit group, and together develop protocols across all of those safety measures. If COVID got into any of the shelters, it would just go like wildfire.
So one of the primary things that Sulzbacher led the charge on for the Jacksonville community was one being a COVID positive hotel and the second being a medically vulnerable hotel. We tried to get them off the street and into their own room to prevent the possibility of them being exposed. In addition to the screenings and the different things we were doing at the campuses, there were significant logistics, as far as transportation, getting them there as new people came in, how we're going to do the meals, staffing. It's almost like starting two new shelters in the middle of the pandemic.
And our staff was scared, right? Everybody was scared. But our staff, who was committed and coming to work every day and testing people and screening people and still seeing our patients. Right now, you can walk up to any of our clinics, the beach, the village, downtown, and get a vaccine. No appointment, no anything. Doesn't have to be a patient of ours currently. If you want a vaccine, we will give you a vaccine.
So Jacksonville is an incredibly collaborative city. We are blessed with an amazing number of nonprofit organizations that have worked together for a very long time. The mayor knew that in order to make sure to really perpetuate that type of collaboration, to showcase it and to celebrate it, we reached out to Secretary Carson at the time, who was the Secretary of HUD, and requested that Jacksonville be the first city in the country to launch the HUD Philanthropic Award. We pulled together an independent jury panel. The jury panel was very impressed by the leadership that Sulzbacher conveyed, and in this instance, Sulzbacher saved lives by creating this rapid response, whether it was launching the mobile medical unit bus to be able to deliver services, launching a second urban rest stop in order to develop responses to the increased number of individuals needing access to care. And at the end of the day, that's what Sulzbacher did.
Sulzbacher is being recognized for their amazing COVID-19 response while continuing to serve our homeless populations. They were selected because of their multi-pronged strategic approach in response to the pandemic, which stemmed the spread of the virus among our community's most vulnerable. Cindy, it's a pleasure and honor. Please come forward.
So we've been without volunteers for 18 months, and that was the backbone of our meal program. So we had to still do 1,500 meals a day with no volunteers. So at one point in time, our whole dental staff was coming over cooking meals because we had to shut down dental for the first couple of months. So it's been all hands on deck, and it's been pretty incredible.
So when COVID hit, we had to make some changes, obviously, just to keep everyone safe, not only staff, but people that we serve. As far as the kitchen is concerned, we had to change the way we serve meals. We went from being personable to grab and go. Even to say hello to our clients was almost impossible.
So basically, yeah, where there was no volunteers, we had to close the dental for emergency services only. So we ended up being available, went to the kitchen, and I was very, I wouldn't say surprised, but I loved the food they were making.
Over 3,000 volunteers come in a month. I lost every single one of them. Kitchen staff, I am so thankful for them because they were able to adapt.
And teach, I learned a lot. I learned that you could cook a lot more from scratch than I realized, and that was amazing.
One of the greatest part about it is, like Zach said,
showing that people were willing to go and help wherever it was needed, to get through this one day at a time. We really tried to do that as a Sulzbacher family.
Everyone pitched in where it's needed, not just the kitchen and dental.
Medical, dental, screening, doing tests, all of it. It was amazing.
Something great to see, for sure.
Yes.
So we're set up in one of our partners in City Rescue in their back lot, and we're with UF Health, and across the street there's a homeless male in crisis. One of our staff members went running to go help them. We run towards the disadvantaged and the homeless individuals, and we run towards the crisis.
The staff here have, throughout the entire pandemic, have really put themselves at risk. And I was really honored to be part of all that, to be honest with you.
We have never shut down. We will never shut down. We will be here for you throughout whatever happens.
And for me, one of the greatest part about it is we've created a bond.
A relationship.
Yeah, I mean, we see each other and we light up and we're just so happy to see each other.
Hi,
always say hi.
In the mornings, I love it.
I'd like to say thanks, Zach, again.
No, thank you. I appreciate you. Yes, sir. Thank you. I appreciate you very much.